Initially, the service was flagged up to us by GP colleagues who were concerned that long waiting times were a barrier for patients to access the service. So they were very keen to work with us to do everything we could to reduce that so that patients could access the service more easily.
We see a lot of people with musculoskeletal problems of various types, from sports injuries to right through to the elderly with chronic problems. And we make an initial assessment and exclude any other serious medical problems. If we feel that the patient would benefit from physiotherapy, we then refer them to the community physiotherapy service.
I went to my local GP and he referred me to the physiotherapist, which is in a new building not far from where I live. So that was good, but I just thought that the period of time from seeing the GP to seeing the physiotherapist was a little long.
The GP thought that I should see a physiotherapist, gave me a form to fill in, which I had to complete, send off, and then wait for 10 days and then ring them up.
After seeing the GP, I would, as I said earlier, I would have thought that having a physiotherapist 1 or 2 days a week at the centre would make the speed of the appointment a lot quicker.
I then got an appointment which turned out to be 5 weeks after my original letter. So I was still in quite a lot of pain in that time and having to take painkillers, having disturbed sleep, etc. So that was quite a long time, I felt, with somebody with some severe pain.
From a GP perspective, all my colleagues and myself included were finding that the access to physio was really slow. The fact that we used to have a physiotherapist in the practice who I could have a conversation with in the corridor about a patient, she was then removed from the practice, as happened across the city in the previous redesign. The patient fills in the self-referral form, so we've lost that ability to communicate with the physiotherapist. So from a GP's point of view, it was, you know, less than a quality service.
A stretch. We don't need to be stretched anymore, then.
The experience with the physiotherapist himself was really good. He was excellent, but I felt that I could have been seen a lot quicker and actually a lot more locally. Because although I can drive, clearly if I were more immobile than I was, that would have been difficult, and getting there by bus would have been very difficult indeed. So the actual experience of the physiotherapist was excellent, but the process of getting to see him was really difficult.
The main aim of the project was to ensure we have a city-wide physiotherapy service for all Sheffield's population, to make sure that everyone receives equitable care, and if they need any specialist treatment for joints, be that knees or elbows or wherever, that they all have exactly the same referrals, they have exactly the same treatment, and they will have rapid access to the best possible care they can.
For a project like physiotherapy, there are individuals identified from each directorate who've got a responsibility to take the project forward. So there's been clear involvement from public health, from strategy, from standards and engagement, finance, performance, all aspects of the directorate to make sure that we've considered everything has been incorporated into the service specification, so that we're clear both in our minds and also so that we can make clear to providers, to bidders who would be interested in delivering the service, exactly what the requirements are and what the outcomes are that we're trying to achieve.
The process that we went through to start off the physio project involved me supporting the strategy directorate in developing the service spec, and for this I had to assess the demand for physiotherapy services in Sheffield and agree a financial envelope.
I think the commissioning cycle is working extremely well. It's involved a lot of collaborative working with a lot of key stakeholders, patients, clinicians, people in strategy and in the procurement process itself. So I think we have gained quite an understanding of what our patients are seeking from the new physiotherapy service in Sheffield. And I think it will help us be able to monitor the service that's successful in the procurement process, and to actually see over the coming months whether that service is actually delivering what our clinicians need from a general practice perspective, but also what our patients are looking for.
By filling in the form with the physiotherapist, I found that was very beneficial, not only to me but to other people. So it makes the appointments quicker. You can then give your opinion on what you think about the system. And for me, it worked very well.
I hope that we've created a very good service for patients that GPs across the city will find works in their favour, that they find that it's a usable service, and I hope they get good feedback from their patients.
It's really good to hear that what I said is being taken notice of. I know lots of other people would have said it as well, but it's good to have that feedback from the service itself that there will be changes made. The service is going to be redesigned to give me probably a more local service and probably a quicker service. So I'm looking forward to hearing the results of that redesign.